I'd like to call to order the HHS meeting of February 15th. Roll call, please.
We got Chair Renahan,
Here.
Vice Chair Swartz, Member Selman,
Here.
Member Chaplin,
Here.
Member Dessert,
Here.
Member LaPlante.
Great, thank you. We have a quorum. Do you have any public comment?
No public comment.
Okay. So first of all, I've been asked to just mention a housekeeping matter of community services grant funded training and travel request that we approved on 12/7/21 and went through county board on the 14th of December was rescheduled to a March 1st to March 3rd due to COVID. So you will not see it on our agenda. So apparently, according to our amazing state's attorney representative here, we don't need to vote on it, but we do need to mention it. So the cost of that item was $617. So moving on to, we've already had the photo op here, but as we've seen and discussed on this committee and also on economic development, these difficulties in childcare prevented families from working consistently and confidently, and a real barrier to financial success for parents, and as well as a challenge for our DuPage County employers. And COVID has only exacerbated these issues. So I reached out to Marianne Courtney of the Y. I've worked with her at Wilbur Corner, and she's a senior manager of strategic engagement, who then connected me over here. We have Shelley Bromberg Lambert, Chief Reimagination Officer at the Y Executive Team, and Jeanette Connor, who is the Vice President of Early Childhood Services. So we look forward to hearing their expertise in this field and the state of the county vis-a-vis childcare. So I welcome you, and we will hear from you at the end of the meeting. So, moving on, I will ask for a motion to approve the minutes of January 18th. We have a motion, we have a second. We have questions, additions, comments. All in favor?
Aye.
Aye. All right, those are approved. I will take a motion to approve HHSR 9022 resolution approval for a fifth modification, neighborhood stabilization grant agreement, first modification, subscription agreement, CHAD project NSP 8-01 to correct affordability period from 40 years to 15 years. So we had a motion. Second. Questions, comments? All in favor?
Aye.
Thank you. That's approved. Take a motion HHSR 9122 resolution recommendation for approval of seventh modification to neighborhood stabilization grant DuPage Habitat for Humanity project NSP 8-02 correcting affordability period from 40 years to 15.
Second.
Motion and a second. Questions, comments? All in favor?
Aye.
Thank you. That's approved. I'll take one motion HHSR 9222 resolution recommendation for approval of a sixth modification to neighborhood stabilization grant agreement with DuPage Habitat for Humanity. This is NSP 8-02A rehab of 148 East Montana Avenue, correcting affordability 5 years. We have a motion and a second. Questions here? All in favor?
Aye.
Thank you. That's approved. I'll take a motion on HHSR 9322 resolution recommendation for approval of a third modification, second time extension to the CDBG agreement with Glendale Heights. Project CD 19-27 water main improvement phase, extending project completion date to May 31st, 2022. We have motion second. Questions here? All in favor?
Aye.
Any opposed? That is approved. I'll take a motion on HHSR 9422 resolution recommendation for approval of third modification to CDBG agreement with Ray Graham. CD 20-04 renovation of Circle Hill and Elm Community Integrated Living Arrangements. Reducing scope of work, reducing reward by $30,367 and extending project completion date. All in favor?
Aye.
Any opposed? Approved. Take a motion HHSR 95-22 resolution recommendation for approval of first modification CDBG with West Chicago. Project CD 21-03 Fair Meadow subdivision rehab priority, changing scope of work and increasing the award by $200,000. We have motion, we have second. Questions here? All right. Member start.
How is the scope of work being changed?
I can take that one.
Yep.
Adding water main.
Adding water main.
It was a streets and sidewalks project, and now they're adding a water
So great. Yeah, and that was unforeseen in the first proposal of the project.
main. You're right. So they could have applied for that. They had, in between the time that they applied and the time we greenlighted them to go forward, they had 5 water breaks on that line. So then they thought, well, if we're ripping up the sidewalk, we're ripping up the street, why don't we do the water too? And we had the money, so we.
Perfect. Thank you so much. I appreciate the information. Thank you, Chairman.
Okay, any other questions on this item? All right, all in favor?
Aye.
Any opposed? Take a motion on HHSR 9622 resolution. This is a recommendation for approval of a second modification for ESG memorandum of understanding with community services and homeless management information systems project at ES 20-06, increasing the award by $98. All in favor?
Aye.
Any opposed? Apparently that's like a bureaucratic housekeeping. Yeah, right. Moving on to the care center. I will take a motion to approve change order HHSP 58P-21 amendment to resolution HHSP 58A-21 issued to Nova Staff Healthcare Services to provide supplemental nursing staff April 10, 2021 through April 9, 2022, increasing encumbrance by $195,000. We have a motion. Do we have a second? Second. Thank you, Member Solomon. Questions here? All in favor?
Aye.
That's approved. Next one is a roll call. I hope I remember when we get there. Take a motion to approve 2022-23 recommendation for approval of contract purchase order to Erdu Werwas LLC for legal services to represent the care center. March 1st, 2022 through February 28th, 2023, and not to exceed 22,000. Your motion is second. All right. Roll call, please.
Okay, Member Schwarzy.
Aye.
Member Selman.
Aye.
Member Chaplin.
Aye.
Member Desart.
Aye.
Member LaPlante. Chair Runyan.
Hi. All right, that's approved. On these next set of items, I will request a motion to combine budget transfers A, B, C, D, and E.
So moved. Second.
Okay, all in favor?
Aye.
All right, thank you. Then I'll take a motion to approve all of these budget transfers. Let's see. 8A, budget transfer covering end fiscal year 2021 collective bargaining, Roscoe for increased final negotiated contract architectural services for facility assessment, replacement recommendations for future ARPA. $283,552 for the care center. 8B, transferring monies to cover end of fiscal year 2021 for providing lab services for COVID for employees at the care center due to COVID-19 pandemic. Purchases that were not covered under CARES or ARPA, $575,515. 8C, budget transfers fiscal year 2021 due to outside agency checking account activity now being reported to general ledger for the care center, $151,299. 8D, transferring monies to cover end of year deficit due to FY21 accrual for compensated absences, $12,264. Aging case coordination unit community services. And finally, 8E, also for community services, transferring monies to provide additional funding for senior services due to increase in wages based on study conducted FY21 $137,000. We have a motion and a second. Any questions on the budget transfers? All in favor?
Aye.
Any opposed? Those are approved. Again, I will take a motion to combine consent items A, B, C, D, E, F, G, E.
Second.
All in favor?
Aye.
Great, those are combined. I'll take a motion to approve consent items 9A, decrease Delta T Group by $75,000. 9B, decrease in close contract 4438-1, Panagold Baking Company at $11,231.24. 9C, decrease in close contract 5100-001, Panagold Baking, $22,223.48. 9D, decrease in close 4487-1, Serve DV John Inc., $42,251.69. 9E, decrease in close 4384-1, Serve John's Donuts, $13,037.32. 9F, decrease in close 4807-1, Serve Kronos Inc., $17,717.50. And 9G, decrease in close 1289-1, Serve Fitzsimmons Hospital Services, $16,378.62. Your motion, we have a second. Any questions on the consent items? The motion is to receive and place on file. Yes, for the consent items.
Yes.
All right. All in favor?
Aye.
Any opposed? All right, those are. I'll take a motion on informational item grant proposal notification GPN 7-22 CDBG with HUD $3,929,528.
Second.
A motion and a second. All in favor?
Aye.
that we receive and place on file. I'll take a motion to receive and place on file grant proposal notification GPN 8-22. This is Emergency Solutions Grant FY 22 with HUD $299,023. A motion second, all in favor?
Aye.
Any opposed? That is passed. Take motion on GPN 9-22 Home Investment Partnership Program. Again, HUD $1,794,890. Motion second, all in favor?
Aye.
Thank you. Take a motion on GPN 10-22 Recreation Therapy Grant, DuPage Care
So
Center
moved.
Foundation, $20,709. Motion second, all in favor?
Aye.
Take motion on GPN 11-22 Music Therapy Grant FY 22
So
for the
moved.
Care Center, $55,332.12.
Second.
Motion second, all in favor?
Aye.
And finally, take motion on GPN 12-22, also with the Care, DuPage Care Center
So
Foundation
moved.
Coordinator Grant FY 22, $25,837.41. With a motion
Second.
and a second, all in favor?
Aye.
All right, great, thank you. And we do not have residency waivers.
No residency waiver.
Okay, great, thank you. For the Care Center update today, I think we have Anita on the line.
Good morning, everyone. Can you all hear
Okay,
me?
welcome.
Thank you. I'd like to start out with the COVID update. I'm glad to say that all our units are now out of quarantine. There's really no one in our COVID unit. No resident or staff have tested positive in the last 14 days. And if the above trend continues, we will be considered out of our outbreak status within 7 to 10 days per the IDPH guidelines. So that is really good news for us. There is a new mandate from IDPH and CMS. They are changing the definitions of what is meant by fully vaccinated and up-to-date vaccinations. So they're no longer using the term fully vaccinated anymore. They're using the term up-to-date vaccinated. And the difference is if you are considered up-to-date with your vaccinations, they are including the primary vaccine series and the booster. So that is the term that we're shifting to. We have to use the term up-to-date vaccination, and we have to now keep track of the boosters and report the booster information, which we had, just so you know, been reporting in the past to the CDC anyway. So basically, if you don't have a booster, you are not considered up-to-date. And if you're not considered up-to-date, what that means is you have to wear full PPE. And here at the Care Center, for staff and visitors that are not considered up-to-date, that will be a gown, a KN95 or higher mask, and face shield. Any questions on that? We are still in the process of collecting data. So next time I can give you data of who's completely boosted and who's not. I can give you those rates next time.
Okay, member Selvin has a question.
Sure.
So for fully boosted folks, I've noticed that sometimes I'm supposed to get boosted every 6 months, but if I had immunocompromised thing, or if I was older, some people it's 3 months. Are we tracking at that level of minutia per employee? Or are you kind of just saying like the CDC giving you guidelines or something that it's 6 months?
Well, frankly, we have to track that, but we don't have anybody that is requiring the 4th booster yet. They are requiring the 4th booster for certain diagnoses and those that are immunocompromised. But if we actually have to track that, but that one I can tell you we don't have anybody.
Okay, thank you. I
That is
imagine this is a nightmare to track, so thank you for all your efforts here.
It is, because we want to make sure we have proof of evidence, before we document that. So we have to change and adapt and modify the way we track. So we're currently working on that too. So with that, the testing requirements, they basically are, if you are not up to date with your vaccination, we have to test you 1 to 2 times weekly based on community transmission. So if the community transmission is low, then it's 1 time a week. And for that, we have to go to the CDC website directly. And then if it's substantial or high, we have to do 1 to 2 times weekly. And so with this, we are also currently, just to let you know, we are reviewing referrals for short-term and long-term admissions. And hopefully we can build back our census. That is our goal right now.
All right, great. Well, thank you, Anita.
No problem. Thank you.
All right, thank you so much for being here. So I'm going to move on to community services update. Mary Keating is hanging with President Biden today at NACO, so she can't be here today. Dave, did you have anything?
Oh, I don't have any updates to give me anything to pass on.
Okay, well,
No.
fair enough then.
There's some good news.
Yeah, and with that, I will move on to our presentation. Please come on over here. So we've got DuPage County Childcare Gaps, right, WCA, as I said, Early Childhood Services, Shelley Bromberg and Jeanette Connors. Thank you.
Thank you. And first of all, let me thank you for tackling this issue. This is obviously a passion of ours, but is something that we are very happy to see that the county is looking at. We hope today to give you an overview of the work that we do, what the situation is in the county, what some of the funding is already available through the state and federal, and then some gaps and some potential thoughts that you might want to consider for DuPage County. So first of all, if you want to turn in your packet to the slide that shows the little map on there, it's the third slide. We will show you that this is the YWCA is the Child Care Resource and Referral Agency for DuPage, Kane, and Lake County. And many people, when they think about the Child Care Resource and Referral Agency, know that we provide child care assistance programs to families that need it to pay for their child care. What they often don't understand is we do workforce development for the field of early childhood. We bring training opportunities to the staff to make sure that they're in compliance with the training that's required by the state, making sure that they upgrade the level of quality and sustainability for all child care providers. And you can see a list of all of the services that we provide throughout the county, as well as doing some direct services with our Head Start, Early Head Start, and preschool programming. We do home visiting as well to make sure that parents are strengthened. So we really look at supporting childcare providers, educators, and families, as well as the children that experience the programs. Next slide, you see why childcare is so important. Everybody knows that circle on the left, the children, why childcare is so important for children. There's been lots of studies about if you give a strong foundation for early childhood, children are set up for success. You see that they are not only set up for success in school, but later in life with work and lack of being involved in the juvenile justice system. So it's a very strong foundation. We're preparing them for the future. We also, and you guys probably think what part of us here is what you're hearing from parents, why it's so important. They need to have sustainable childcare in order to be able to do their job and to work. And there's been a lot of studies about how important it is when families have reliable childcare, how much that makes to the productivity in the field and with their employer. But what is also important is what it does to the economy. People who are able to stay employed and they have really reliable, high quality childcare, they're able to stay in the workforce, and that has tax implications to the county. Also, children in high quality learning environments obtain higher incomes and purchase homes, and that all as well impacts the county in a very positive way. Next slide, you see some statistics about our early childhood system. The sector is primarily composed of women. Most of the people who work in early childhood, 90-some-odd% are women. What a lot of people don't understand is also a lot of the people who work in the field are people of color. And you can see some of the statistics. Over 50% of those working as teachers, assistant teachers, and family childcare, those are the individuals who do childcare out of their home. What's great about the field of early childhood too, is most of the time, early childhood, the teachers in the field are representative of the community in which they serve. So if you are in a ethnically diverse community, you see that in your teaching and assistant teaching staff. We're also seeing an increase in English language learners in the field of early childhood. 42% of students are seeing that increase. What is really dismal about the field is the level of wages that you see that are paid to the field. And think these are predominantly women and women of color. If they are a teacher, the average wage is $13 an hour. So as you can see, that is a very dismal, and then it only gets worse if you're an assistant teacher and other factors. Only 1 in 5 teachers in the field of early childhood have insurance through their employers. So not only are they making low wages, but benefits are also an issue. And this is a statistic that I find.
Is this data from Illinois or from the country or from DuPage County? Because my daughter just got a job as an assistant for $15 an hour. So I'm just wondering where this data is from. Is it national, state, local?
All of the above. So some of it's national, some of it would be state level. So the $13 on the 1071 is an average for the state of
Okay,
Illinois.
thank you.
And you see references in the back of the presentation of all the statistics cited in here.
We're gonna get there.
And 2% of those of all occupations make more money than the people earn in the field of early childhood. So very alarming. Next slide, please. And so this really impacts productivity, as you can see. And the highlight here is when people don't have childcare, it is a big issue. 86% of primary childcare, the individuals who are the primary childcare person in their family, report problems with childcare. And 1 in 5 parents and guardians report being reprimanded because they have a childcare issue in the workplace. So this is definitely something that doesn't only impact the family, but is also impacting employers and their productivity. And you can see that it's been scoped nationally that employers lose about $12.7 billion annually from childcare challenges. So that's pretty significant. And that does translate into lower tax revenues as well. And what we've seen throughout the pandemic is really the decline in the number of women, because if somebody decides to step away because of the childcare issue, most of the time it is the woman. Next slide, please. So here you see, we're going to get to some DuPage County. 2/3 of parents have trouble finding childcare in the pandemic. That has been reported, and that's a statistic from the National Association for the Education of Young Children. You see some of our charts here, and this is pre-pandemic rates, so we'll talk about how it's been exacerbated since then. But you see that it talks about the potential need. There's 43,000 needs for children under the age of 5 here in DuPage County. When we look at slots, and slots is what they use, and the term they use to talk about childcare positions that are available for children within the various centers and childcare environments throughout the county. There's a need, there's only 23,000. So if you look at 43,000, we have 23, that leaves a gap of 20,000. And this was pre-pandemic. So you had a gap of almost 50% here in DuPage County going into the pandemic. And you can see it's not one for one. You see some of the issues of where some of the slots get, and we just highlighted a couple areas where there are pretty significant slots in the percentages that you see. And then talking about what the pandemic has done on the next slide to the childcare picture here in DuPage County is there has been a decrease. A highlight here is throughout the pandemic, we have lost 718 of those childcare slots here in DuPage County. You see a lot of it has been due to decrease in licensed care programs by 57 slots. But you also see in there that there has been an increase in unlicensed childcare. And that is often we attribute to maybe people were struggling finding childcare, so somebody within their family, a neighbor, has taken on that issue. So not only did you have a shortfall here in DuPage County prior to the pandemic, you've had a reduction of those slots there, and you can see the various different settings. When you talk about childcare settings, you talk about childcare centers, which you're all familiar with the centers that you see. There is childcare, what we talk about is family childcare. Those are individuals who are licensed and do childcare in their home. And then there is also unlicensed or licensed exempt childcare that happens in the home environment as well. Next slide. So here, this graph, what we want to show you here is the current challenges have been exacerbated. When we went into the pandemic, and it's nothing new that the wage in early childhood has been a dismal since I've been in the field for 30 plus years. But we had the low wage, and then with the pandemic hit, we reduced the ratios in the centers for health and safety reasons. But because there's such a low margin in childcare, they had to lay off their teaching staff when they reduced the ratio. And the teachers left the field because for $13 an hour, they could find something else in another industry. And so then many of the providers, when they were able to re-up their ratios and have a higher capacity, they can't. They're not operating. You see, 71% of licensed capacity is what they're operating at. And that is because they just can't find the teaching staff to work in the classroom. So the classrooms remain understaffed. It's this vicious cycle that we see ourselves worked into. And this is the next slide, just talks a little bit in comparison and what the average hourly wages are in some of the competitors. And many people who leave the field do not only leave the field because they're going to another childcare provider when they leave their position, they're usually leaving the field altogether. So we've lost them to the industry. Next slide. And I'm going to turn it over to Danette. She's going to talk a little bit about how we can approach this work and how for the long term and not just the quick term fix. Thank you.
So thank you guys for having us today. Getting DuPage back to work really does involve childcare. And so we believe that it should take a focused approach. First of all, we have to stabilize the field. We have to keep those businesses open, keep those teachers from leaving, keep and recruit families in the program. Those are all key. We have to make sure we're just adding some breath into the field that has lost a lot of capacity. Then moving into the second phase of it, we believe we need to build additional capacity. We have to rebuild that capacity that was lost in the pandemic by building up some of those businesses that we lost, and then add some capacities to the existing businesses to make sure that we're really filling the 20,000 gap that we saw pre-pandemic. And then we need to adequately ensure that we have a good supply compared to in each community what the need is. The last thing is sustainability. So it's going to be for naught if all of these state and federal funds go into childcare for 3 years and then we have a gap. So we need to make sure that the field is desirable. We need to make sure that employers are engaged in the process. They have some buy-in, they understand the impact that's on their workforce. And we're building resources then for the childcare providers and those families. You saw a big gap. We've seen a decrease in the number of families that are accessing the childcare assistance program in DuPage County as well.
Okay. So you have these 3 separate sort of goals or objectives, and it would seem to me that making the field desirable and employer engagement is a key, and maybe falls under all 3 of those things, because if you don't do that, you can't stabilize the field, you can't build additional capacities.
Correct, yeah. So I think there's this immediate need that comes in from, we just need to make sure that there's teachers in these classrooms that allow the families who are looking for care to get back to work. But that sustainability is necessary to start from day one.
Okay.
Next slide, please. So the complication of running a childcare business is that you can see, and on that left side, a childcare provider needs to be able to charge a tuition, and they need to be able to receive tuition in order to cover the cost. So that can come from state, it can come from private pays, it can come from co-pays. And then they get some additional stuff from the state that says, if you serve healthy meals to children, you can have this stipend. If your quality is in the classroom, then you can have this amount of money. And all of that money is then filtered into teachers' wages, benefits, and that cost of quality. So when the enrollment is low, a lot of times what childcare providers will do would be to decrease their tuition to make sure that they're attracting more parents into the program. But the math doesn't add up. If they can't pay the teachers, the lower tuition means lower pay to teachers. So it sort of exasperates. It's really a very challenging field to run. And you've got small business owners who don't have a lot of business background to really understand what we call the iron triangle. So some of those recent investments in business retention in 2020 and 2021, The governor and the Illinois Department of Human Services put out some childcare restoration grants. And those were really grants to help them weather the pandemic. They were given to the childcare providers to help them keep their doors open because the ratios had been decreased, so they weren't receiving tuition. The other thing that they did put in place was some attendance exemptions through the Child Care Assistance Program. So that was for low-income families. If families weren't in attendance because, well, they couldn't go to work because restaurants were closed, then, you know, they would allow them to continue to charge the rate to this already funded system in order to cover those costs, because they were, again, trying just to keep the doors open of those childcare businesses. Go to the next page. The next round of grants that have just been released in late 2021, 2022 are called Strengthen and Grow Childcare Grants. Those are also managed by the Illinois Department of Human Services, and they're designed to really focus in on the workforce. So, but they're required to spend a quarterly award of 50% of their funds to recognize, reward, and adequately compensate the workforce. So that's where it's at. 50% of the funding they receive has to go straight into their teachers, existing teachers. They can spend the remaining award on additional workforce investments or use other funding to enhance their childcare environment. So children in classrooms abuse books, they abuse materials, they need those things to play with. So all of that comes with a cost. So they can choose to invest in their workforce and into some of those quality materials. So the other funding that came through is the Early Childhood Access Consortium. So managed by the Illinois Student Assistance Commission. There's this program that came out to help the early care and education professionals advance their degree. So it's a one-year program. They can get some funding. And then we hired some navigators to help them. They're kind of like higher ed advisors to help them find and enroll in National Lewis and College of DuPage here in DuPage County. And there's grants. So we would help them with their FAFSA, help them with their Pell, help them with their MAP grants. And then there's additional grants out there. So that funding is kind of layered on as well. And then another existing program that has been here in the state is the Great Start Wage Supplement. So if a childcare provider does advance in their degree, they can get a wage supplement they can apply for. These are underutilized funds in the state, and childcare providers can't make more than $18 an hour to get this reimbursement. But they do get a reimbursement check, and it's sent every 6 months, I believe. So who qualifies for Strengthen and Grow grant? So that was that big bucket of money that's going to be out there. Programs licensed as a child care center, a child care home, or a group child care home. Group child care home means that they can serve up to 13 children in their home. They had to have been in operation as of March of 2021 and operate full day and full year. So it does not cover the cost of preschool programs or anything that's like a before and after school. They have to enroll 10% or more of the program's licensed capacity with children in the Child Care Assistance Program, and have to receive no more than 50% of their total child care program site revenue from those state or federally funded programs like Preschool for All Expansion, Head Start.
And just a note to the committee, this is the stuff you're probably going to be hearing in the news. This is like very much right now what's being rolled out. So this is all the things you have to do to qualify. And then moving to who doesn't qualify.
Exactly.
Aspect.
So next slide. So DuPage County is a unique county, as we all know, those of us who live here. Programs must choose between receiving the previous funding, which was CCRG, those child care restoration grants, extensions, and Strengthen and Grow. So if they're running an extension on those previous grants, they do not qualify. Licensed exempt child care. So if I'm caring for a child up to 3 children in my home in the evenings so that my, nurse neighbor can work, I do not qualify for these grants. Any businesses that have started after March of 2021 do not qualify. Programs who don't operate full day and full care, and then programs who've enrolled less than 10% or more of the program's licensed capacity in the Child Care Assistance Program during any month in 2020 and 2021. So that's key because DuPage County, that is one of the big caveats here is we don't have as many people utilizing the Child Care Assistance Program. So even if I'm a child care provider and I want to serve those families, if I don't have them enrolled, it doesn't matter. So I do not qualify. So you can see on the right, the number of child care businesses by license status. On the blue, those programs might qualify. The ones in the orange will not qualify for these funds. And below, the programs that are in blue who have are currently receiving child care assistance program payments could receive these funds. However, the child care providers in orange, which 47% of the child care providers in DuPage County do not qualify for these funds. So same with the Access Consortium, they're basically giving this to anyone that wants it. So these awards are pretty readily available for teachers that are currently operating in a classroom. They're for 2-year and 4-year entities. I mentioned National Lewis and College DuPage are in DuPage County. You go to the next slide. So people who don't, there's only 20% of the workforce that is being targeted by this. And I think what's really key here is that the funds are limited and childcare providers need those teachers in the classroom. So when are they getting that education? If they don't have a substitute, if they don't have backup care, then going back to National Lewis and College DuPage may not be something that makes sense for them. So that's where we're going to see some difficulties there. Next slide. So this is really where we feel like stabilizing the field. So that first point that I made, we really need to make sure that there's some dedicated recruitment efforts out there to decrease to address that decrease in teachers. We want to make sure we're building up that workforce by layering that state and local funding and providing potentially some grants to those childcare providers that don't qualify for them. In the second stage of that, access to childcare as a workforce development strategy is, again, that recruitment. We need to make sure we're addressing the number of families accessing childcare. So we've not only seen the number of childcare teachers decrease, but the number of families who are accessing, whether it be the state assistance or just private pay, has decreased in the pandemic. So we know that there's less people accessing childcare.
A lot of times that is just because they just don't know that they qualify. They're intimidated by the process. We've worked with the local workforce development that we've actually presented to them so that when they're working with some of their members, they're able to help counsel them and send them our way.
In that third bullet, that's providing home visiting services is key. We currently provide some home visiting services in DuPage, but limited. And so family relationships are key when we're talking about that family well-being and making sure that children are showing up in those classrooms. And parents aren't just sticking them in front of a TV while they're taking on another webinar call. And then the last one is really making sure that we're offering mental health programs. So what we're hearing a lot of now is childcare providers are saying these kids are coming with challenging behaviors in the classroom. Challenging behaviors. Challenging behaviors means the child's not eating, the child's not napping, the child's hitting, the child may be trying to distract or throw things in the classrooms, and the teachers are burnt out. They're already low staffed, they're frustrated. Mental health support for those teachers is vital at this point.
There's a direct correlation in studies that show that the quality of mental health of the educator in the field of early childhood has a direct reflection on the quality of care, which it makes sense that they're providing. And if you want those long-term sustainable effects that you get from high quality childcare, this is a key component and it's been exacerbated by the pandemic.
So the second part we talked about was the building the additional capacity. So a licensed exempt family childcare provider can serve up to 3 children in their home. Licensed family childcare can serve up to 7 children in their home and potentially 13 if they have an assistant. So they can serve up to 13 children in their home. Childcare center ratios vary, it depends on age. So younger children need lower ratios, so they need those teachers to really be dedicated to them. Where you can get a little bit higher with some of those older age groups. But on average, if we look at just family childcare, opening up one family childcare business really creates opportunities for 7 working parents plus that childcare business. So you're talking about 8 employment opportunities for one family childcare business. Next slide. So what we think for sustainability, these childcare providers need to be insulated. They need to have a network. There's a lot of work that's been done nationally around shared networks where childcare providers who are pulled together in a regional network can access shared back office supplies, shared marketing. They might have shared substitute pools, and then other shared resources. So some of that mental health and all of those things that are coming in, those shared services are of value because it reduces the cost of what they're paying in their business.
So it allows them to be much more sustainable. Because you think about childcare, you know, a lot of times you think about the big national players, the corporate childcare, the KinderCare, the La Petites. Childcare is really made up of small micro businesses. And the large players really have less than 30% of all childcare across the United States. So we really have to sustain them because most people who get into the field of early childhood get into the field because of the love of children, they're educators, not because they have a strong business acumen. So if we can insulate that pieces of them, their sustainability will be much stronger.
Mm-hmm. So the last slide, and this is where we'll close, is that managed childcare provider services network is really what we're proposing for sustainability. But then outside of that, it's really going to take us all. Having lots of conversations with WorkNet DuPage, because once this 3-year funding is done, how do they continue to help us to educate and make sure that there's a trajectory for these childcare providers from a long-term status? So we're really building that apprenticeship program within the schools and then outside of it. Then really, again, going back to those businesses, our businesses need to become partners to us in the early childhood field because it is not a publicly funded system. So if businesses are going to be successful, they're going to need a vital early childhood workforce. And so what we would do is use that layered funding from the federal government, from the state government, from the local, and layer on a lot of those resources with the Child Care Assistance Program. I'm sure WIOA comes in here at some point, Great Start, WorkNet. All of those funding systems can be layered on to really, again, insulate those childcare providers, because if we work together, we can have a stronger collective impact, create long-term sustainability, and to build a system in DuPage County that really makes the field desirable for the entrants who are coming into it. And we can avoid that crash and build some strong structural reform into the system.
Great, thank you. Do we have any questions? We had a pretty comprehensive and technical presentation here. I appreciate, the education. I mean, there's so many moving parts, I think, to this. And that's why I think it's important we discuss it here. I would hope, economic development, we continue some of the conversations. But if we don't have any questions, I thank you for being here. I'm sure we'll be hearing more from you.
Please let us know if you have any questions. And as you said, Julie, it is very technical. There's so many pieces. This is part of what is overwhelming to people in the field as well, is what do I qualify, what do I qualify, and how can we build a sustainable program. So thank you.
And clearly a lot of gaps. So thank you. I'm going to ask for a motion to include Member Garcia for quorum purposes.
Second.
Right. Thank you. All in favor? Aye. All right. Thank you. Welcome, Member Garcia. Give old business. I'd just like to thank our Vice Chair Schwarzy and Member Chaplin for attending the balloon blow up festivities that were going on at the Care Center. And Member Garcia, I'm sorry. Sorry. Now you're in the committee, right? And who else? Member Zay was there? Yeah. Anyone else?
That was it, yeah.
But thanks for participating. I saw lots of smiles online of, our seniors.
Yeah, it was a really great one.
I only over blew up 10 or 12 balloons.
Yeah.
Scared the bejeebers out of everybody every time they popped.
You're just helping on.
But
They
took
moved me
them
to tying strings because
They were running out of balloons.
Yeah, so a happy time to be had by all. Thank you, Joan, for your help in publicizing that and
Glad we
everything.
could do it finally again.
Yeah, been a while. So, any other old business or any new business? All right, I'll take a motion to adjourn.
So moved.
Second, all good?
Aye.
Aye. We are adjourned. Thank you all very much.